Over the age of 40, our oral health can undergo some pretty drastic changes, and there are 3 key warnings that you should not ignore. These are signals from your mouth that something isn't right, but many people don't realize they're getting these signals until it's too late. So if you're over 40, you need to understand these warnings, because if you do, you could save yourself from future pain, discomfort, expense, and even tooth loss. Warning number 1. Gum recession. This first warning sign may not be immediately obvious, but it can have far-reaching consequences. Many seniors find that their gums appear more receded than before, exposing more of their teeth. Now, while this may seem like a minor cosmetic concern, gum recession can be a sign of a much bigger issue. This is because when gums recede, it exposes the sensitive areas beneath them, making teeth more prone to decay. It also means that bacteria and food particles can more easily reach these vulnerable areas, leading to infections and further gum problems. And here's the thing, gum recession is often a silent process. It happens slowly over time and doesn't always cause pain or discomfort. This means that many people don't take action until the damage is significant. But there's good news. If you notice any gum recession, it's essential to see your dentist right away. They can determine the underlying causes and suggest treatments ranging from improved oral hygiene practices to professional cleaning or even gum surgery in more advanced cases. But remember, addressing the issue early is key. Don't wait until it becomes a major problem. Warning number 2. Tooth darkening. Another potential indicator of trouble is darkening of the teeth. Now, this isn't just about surface staining. It's an indication that something deeper might be happening. Here's why. Tooth darkening can mean that the inner layers of the tooth are in distress. It's kind of like when you bruise yourself and the skin around the injury turns dark. Your body uses this darkening as a way to alert you that there's an issue under the surface. Similarly, darker teeth can signify nerve damage or inflammation deep within the tooth. This may be caused by decay that has reached the inner tooth, cracked or broken areas, or even severe gum disease. And here's what makes this so serious. Ignoring this darkening could be risky. It might mean that decay is progressing without your knowledge or that an infection is worsening. Remember, untreated decay can lead to abscesses and infections that could spread elsewhere in your body. That's why it's important to address darkened teeth promptly. Plus, it's often easier to fix the problem in its early stages. So, if you notice any darkening in your teeth, don't hesitate to schedule a visit with your dentist. Even if it seems like a minor cosmetic issue, it could actually be a sign of something more serious that needs attention. Warning number 3. Aches and sensitivity. Now, let's talk about a warning that many of us are all too familiar with: aches and sensitivity. As we age, it's common to experience discomfort in our mouths, especially when consuming hot, cold, or sugary foods and drinks, or when brushing our teeth. You might think this is just a natural part of getting older, but it's not. In fact, these aches and sensitivities could be telling you that something is wrong. Think of it like your mouth's alarm system going off. When you feel an ache or sensitivity, it's trying to tell you that something needs attention. It could mean that a tooth is developing decay, that the protective tissues around it are pulling back, or that there's an area of irritation or infection. Similarly, persistent bad breath or a bad taste in the mouth are additional signs that something isn't quite right. These symptoms could indicate gum disease, which is a major issue among seniors. In fact, studies show that approximately 70% of adults over 65 suffer from some form of gum disease. But here's the worrying part. Gum disease can be dangerous for several reasons. Not only does it cause discomfort and affect your smile, but it can also lead to tooth loss. And that's not all. Research suggests that gum disease might be linked to other health problems, including heart disease and diabetes. So those aches and sensitivities, that bad breath or unpleasant taste, they're not just oral health issues. They're potential clues pointing to more serious problems. Gum disease, why it's more dangerous for seniors. gum disease, medically known as periodontal disease, becomes more dangerous as we get older due to a few key factors. Firstly, as we age, our immune system can weaken, making it harder for our bodies to fight off the bacteria that cause gum disease. This means that the harmful microbes can more easily flourish in our mouths and lead to more severe gum problems. Secondly, gum disease tends to progress gradually over time, and since many people don't experience significant pain or noticeable symptoms in the early stages, it can go undetected and worsen silently. By the time symptoms become apparent, the gum disease might have progressed to a more advanced stage, making it harder to treat. Finally, as we get older, our bodies produce less saliva, which plays a vital role in protecting our teeth and gums. Saliva helps neutralize acids, wash away food particles, and keep our mouths healthy. Less saliva means a higher risk of tooth decay and gum disease. The connection between oral health and chronic diseases. The link between oral health and overall health is undeniable. Conditions like diabetes and heart disease don't just affect the body, they can manifest in the mouth as well. For instance, people with uncontrolled diabetes might experience persistent dry mouth or gum problems due to high blood sugar levels. Similarly, gum disease has been linked to heart disease as the bacteria from gum infections could potentially enter the bloodstream and contribute to heart problems. This is why managing chronic conditions effectively and addressing oral health issues promptly is so important. If you're dealing with any chronic health concerns, make sure to discuss them with your dentist. They can help monitor your oral health more closely and adjust your treatment plan as needed. How to identify the early signs. Recognizing the early signs of serious dental issues is crucial for timely intervention. While it's essential to visit your dentist regularly, being aware of potential warning signs can help you spot problems that need attention between dental checkups. Some early signs to look out for include persistent toothaches, swelling, or tenderness in the gums, noticeable changes in your bite, or the way your teeth fit together, loose or shifting teeth, as well as changes in your ability to chew or speak. If you notice any of these signs, it's important to consult your dentist promptly. Early detection and treatment can prevent minor issues from turning into major problems down the road. Oral hygiene routines that change after 40 and 50 to 60. Maintaining good oral hygiene is vital at every age, but the specific routines may change as we get older. For example, brushing twice a day with fluoride toothpaste remains a cornerstone of oral hygiene. However, as we age, we might need to adjust our technique and the type of toothpaste we use. Some seniors might benefit from softer toothbrushes or specialized toothpaste for sensitive teeth. Additionally, flossing once a day between teeth is recommended to remove plaque and prevent gum disease. But seniors who have difficulty with dexterity might want to consider using alternative flossing methods such as water flossers. How often should I visit the dentist after 40 to 50 to 60? Visiting the dentist regularly is crucial for maintaining good oral health at any age. However, the frequency of these visits may change as we get older. After the age of 40, it's generally recommended to visit the dentist for a checkup and cleaning at least once every 6 months. This allows the dentist to monitor any age-related changes in your mouth and address any issues promptly. As we approach 50, the frequency might increase to every 4 to 6 months. This is because the risk of gum disease and other oral health problems tends to rise with age. After 60, it's advisable to see the dentist every 3 to 6 months. Some seniors might even need more frequent visits based on their individual oral health needs. During these checkups, the dentist will examine your teeth and gums, check for signs of disease, and provide professional cleaning to keep your mouth healthy. Tooth aging, fact or fiction? The idea of tooth aging has been a topic of much discussion, leading to questions like, do teeth get older? The answer is yes and no. While teeth themselves don't age in the same way that people do, they can undergo changes over time. Factors like wear and tear, exposure to sugars and acids, as well as lifestyle habits can all influence the condition of your teeth as you get older. These factors can lead to issues like tooth decay, gum disease, and tooth sensitivity. However, it's important to remember that these problems are not an inevitable part of aging itself. Instead, they're often the result of poor oral hygiene or dietary habits. So, while teeth don't technically age, they can certainly show signs of wear and tear as you get older. Practical solutions for each warning. To address the 3 warnings we've discussed, here are some practical solutions. For gum recession, focus on improving oral hygiene, use a soft bristled toothbrush and floss daily. Consider using an antimicrobial mouth rinse and eating a balanced diet rich in vitamins and minerals. For tooth darkening, visit your dentist for professional teeth cleaning. They can remove surface stains and, if necessary, perform more in-depth treatments. Maintain good oral hygiene and avoid staining foods and drinks like coffee, tea, and certain wines. For aches and sensitivity, see your dentist promptly. They can identify the underlying causes, which could range from cavities to exposed tooth roots, and provide appropriate treatment. Improve oral hygiene. Use a soft bristled toothbrush and toothpaste designed for sensitive teeth. How can I prevent losing my teeth in old age? Losing teeth as we age can be a distressing prospect, but the good news is that it's largely preventable. Here are some ways to keep your teeth as you get older. 1. Prioritize oral hygiene. Brush your teeth twice daily with fluoride toothpaste and floss once a day. 2. Eat a balanced diet. Consume plenty of nutrient-rich foods like fruits, vegetables, lean proteins, and whole grains. These provide the essential vitamins and minerals your teeth need to stay strong. 3. Limit sugary and acidic foods and drinks. These can erode tooth enamel and increase the risk of decay. 4. Quit smoking and limit alcohol consumption. Both smoking and excessive alcohol intake can negatively impact oral health and increase the risk of tooth loss. 5. Visit your dentist regularly. See your dentist for routine checkups and professional cleanings. Early detection and treatment of any issues can prevent them from worsening. 6. Consider dental sealants and fluoride treatments. Sealants can help prevent decay in areas where plaque and bacteria tend to accumulate. Fluoride strengthens tooth enamel and makes it more resistant to decay. 7. Use an electric toothbrush. Electric toothbrushes often provide a more effective clean and may be beneficial for those with gum disease or other oral health concerns. 8. Don't ignore oral health issues. If you experience any signs of a problem, don't delay visiting your dentist. Addressing issues promptly can prevent small problems from becoming major ones. Does medication have an impact on your mouth? Yes, certain medications can have an impact on your mouth. For instance, some drugs can cause dry mouth, which can increase the risk of tooth decay and gum disease. These include antidepressants, antihistamines, and certain blood pressure medications. Other drugs can cause changes in saliva composition, making it less effective at protecting your teeth. For example, chemotherapy drugs and anti-cancer medications can alter saliva production and its quality. Additionally, some medications can lead to increased acidity in the mouth, which can contribute to tooth erosion. These include diuretics and drugs used to treat epilepsy. It's important to discuss your medication regimen with your dentist, as they can provide guidance on managing any potential oral side effects. If you notice any changes in your mouth, don't hesitate to ask your doctor or dentist if your medication could be contributing to the issue. What resources and support are available for seniors? There are numerous resources and support systems available for seniors to maintain good oral health. Let's explore some of them. 1. Government programs. Many countries offer government-sponsored dental programs for low-income seniors or those on public assistance. 2. Community health centers. These centers often provide dental services on a sliding scale based on income. making them more affordable for seniors. 3. Dental schools. Dental schools affiliated with universities typically offer reduced-price dental services provided by supervised dental students. 4. Non-profit organizations. Several non-profit organizations are dedicated to providing dental care to underserved populations, including seniors. 5. Volunteering programs. Some communities have volunteer dental programs where retired dentists or dental students